Hello, I am Jess, and I wrote my final paper about healthcare, specifically how healthcare is a fundamental human right and how universal healthcare can be implemented in the United States. So it works for all Americans and not just those who are wealthy enough to afford copays or have great jobs that provide the insurance for them. Um, there's a huge disparity between different classes right now, and a universal healthcare system would help promote that sort of equality, equity, and sort of level the playing field for a lot of people. So research into universal healthcare as a human right is relatively new, with like legal research only really starting in the early 2000s. So we still need to break ground, setting precedent for the argument that healthcare is a fundamental human right. The World Health Organization, in their agenda for sustainable development, that agenda, it's very wide-reaching, but they have an emphasis on the fact that every human being has a fundamental right to enjoy the highest attainable standards of health without discrimination. And I think we all sort of think that. It's a matter of actually getting our government officials to pull triggers and take action. Thankfully, there are glimmers of hope for the United States. You can look abroad and see how most every other country has some sort of universal healthcare system, and some of those range from like fully government funded to publicly funded, and whatnot. And the quality of care is certainly different in each of these places, but you can also look to our bright shining star here in the United States, that is Oregon, and they are planning on being the first state in the United States to have a universal healthcare system for its citizens. And arguably more importantly, they will be the first state to make a constitutional amendment declaring that healthcare is a human right, which is sort of that precedent that we're looking for, to get other states to sort of follow along or get the federal government involved for something even bigger. While most other countries have universal healthcare systems in place, I think one that would stand out most would be Germany's system. They have a universal healthcare coverage that's available for everyone making under $60,000, $65,000. But they also offer private insurance for those making more than that, or if you're if you're an individual, but like if you're a small business owner, you can opt into either. But they have near 100% coverage of their citizens through their system. Whereas in the United States, we still have about 8.8% of American citizens uninsured still. And that's a huge gap. With the Germany system, there are complaints about wait times, especially in the more urban areas of Germany. But it has a very high public opinion rating. But healthcare is just important, period. Because, I mean, the thing that probably everyone thinks of first is that it minimizes the spread of disease, and having coverage around, or having everybody in the world covered, ideally, right? You would minimize those issues. But like I kind of discussed earlier, a universal healthcare would address inequalities and promote equity. And this is really important because minority groups are disproportionately affected by the lack of healthcare coverage. And yeah. A major hiccup that we will face implementing a system that works for all Americans will be what it'll do to our healthcare staff and our workers. I currently work in a hospital setting, and I see a lot of people burnt out around me. And I wasn't here during COVID, but I've heard the horror stories that came out of it. And that frankly put a huge stress test on our American healthcare system. But through job sharing, competitive pay, and not competitive in the sense like, your local Wendy's is offering competitive pay. No, like we're paying these people to do the important work that they're doing. And, streamlining the systems that we use to, just the administrative systems that we use to get people into the system, get people into the emergency department, get them to see their providers, their doctors, et cetera, making that a lot simpler and easier for people to use will sort of meet that healthcare worker burnout gap in the middle somewhere, so we can start addressing those ahead of time before this huge influx of people enter our healthcare system. And through technology and education, we can help individuals stay healthier on their own. Like, imagine being able to diagnose yourself pretty accurately through a trusted app that our government researched and developed, or eating healthier because we are promoting a healthier non-American diet. But frankly, our system has been failing our people, and it's time to change. It's time for the U.S. to recognize that healthcare is a human right, and we need a system that works for all Americans.